Hello, good afternoon, social media family. Today I'm going to talk to you, share a few thoughts about menopause. It is good for our ladies and it is good for every man who loves a woman. So basically, menopause is the stage in a woman's life. It is natural. Every woman who lives long enough will get to that state of menopause. It marks the end of the reproductive years. And so therefore, after menopause, a woman cannot get pregnant except in very rare cases where she is giving special fertility treatment. Most women experience menopause between the ages of 45 to 55 years. In Ghana, the average age at menopause is 49 years, and this is basically caused by loss of ovarian follicular function. So your ovaries fail to work again. They are not producing the hormones, estrogen, that you normally would need to be fertile. And we say that natural menopause has occurred when you have gone for 12 consecutive months without menstruation and you don't have other reasons like physical problems, pathological problems, sickness or disease causing it. Naturally, for 12 consecutive months you have not had your period, then we say that you have reached menopause. Sometimes menopause can be a consequence of surgical or medical procedures. So for example, somebody who has had their womb removed will not menstruate again. So it is some form of menopause, but if they have their ovaries, they may not experience the symptoms that I'll describe later, but they will not be menstruating, okay? Other times, some people have had their ovaries removed for various reasons. Once your ovary is taken out, automatically it's menopause, even if you are 20 or 18 years old, because then they are not functioning anymore. There are some people who are also suffering loss of ovarian function because of interventions like radiation therapy or chemotherapy as part of treatment for cancer. Some people on hormonal contraceptives and certain drugs can also create that state of menopause. There are 3 stages to menopause. The first stage is the perimenopause stage, and this is usually gradual and marks the actual phase that will usher you into menopause. It normally would begin with changes in your menstrual cycle. So usually you start observing that your menses is shorter or longer than it used to be. The flow may be heavier or lighter than it used to be, and this would continue for variable lengths of time. It can last as long as 10 years in some people or as about a year in other people. But the perimenopause comes to an end when you have gone for 12 consecutive months without a period, and then at that point you are in the second stage, which is the menopause itself. There are a lot of changes that are associated with the perimenopause, and it can be physical, emotional, mental, and then even affect your social well-being as well. We'll talk about some of them. Some people do not have any symptoms at all during the perimenopause, and others have a lot of symptoms, some of which even interfere with their daily lives and the quality of life that they used to have. So after the menopause, when you've gone 12 months without menstruating, then you are in the post-menopause state. And usually the symptoms that you're experiencing before at perimenopause would either get better or go away totally. Some few people may continue to experience those symptoms for a couple of years before it totally resolves. And the thing to note about post-menopause state is that because at this point you have very low estrogen levels in your blood, you are at an increased risk for a few health conditions, particularly heart disease. The estrogen protects women from heart disease. So once you hit menopause and your estrogen levels drop, your risk of cardiovascular diseases go up. And then also your bone density reduces by as much as 25%. So you are at risk for osteoporosis and various fractures due to the loss of bone density. There are many symptoms that are associated with the perimenopausal period. Commonly, women will complain of hot flashes and night sweats. Okay, so suddenly you have this feeling of heat on your face, neck, chest, and it can spread all through your body. You start palpitating, actually you feel your heart beating, and then sometimes it is associated feeling of physical discomfort or anxiety. There are changes in your regularity and then the quantity of your menstrual flow. I had mentioned that particularly you can suffer from vaginal dryness, and this will result in pain during sex, and sometimes you even have incontinence. When you feel the urge to urinate, if you do not hurry up, the pee may come, or if you sneeze too hard, then a little bit of pee will escape into your underwear. A lot of women have difficulty sleeping or insomnia. They go to bed and they are not able to sleep all through the night. There are a lot of emotional changes associated with this period. A lot of women become very irritable. The things that normally would not bother them, they become easily angry. They have mood swings. Some people sink into a bit of mild depression, or they become overly anxious about things that they really do not need to be anxious about. Sometimes the menopause itself, because of lack of estrogen, will result in weakening of your pelvic support structures. So then you are at increased risk for situations like pelvic organ prolapse. You can have your uterus or your bladder prolapsing below your pelvic floor muscles. A lot of women would also experience dryness of their skin, their eyes, and their mouth. And along with these skin changes, they also tend to have hair loss or hair thinning. So realize that your hair that was formerly quite thick and nice is now thinner. And sometimes when you comb your hair, you realize that a lot of it is coming out than it used to before. Some women experience breast tenderness. And in some people who have premenstrual syndrome, in this stage of their life, this can get worse. So premenstrual syndrome, it's not everybody who experiences it, but in a few percentage of women close to your menstrual period, you may have a very tender breast, you may have headaches, you may have a lot of edema, a lot of physical changes that occur just before your period. And in some people, when they are close to menopause, around the perimenopause, these symptoms can actually worsen. In a few patients, they complain about racing hearts, headaches, pain in their joints and muscles, and then change in libido or sex drive. Some women have increased sex drive, other people have a decrease in sex drive. For those who have a decrease in sex drive, a lot of the time, it is attributable to the dryness of the vagina and the pain that they experience during intercourse, and that can easily be solved by using a lot of lubricants. These are over the counter and it is easy to get. And then last but not the least, for this particular presentation, some people have weight gain. They tend to gain a lot of weight. In a few patients, we have what we call premature menopause. That is when you attain menopause before 40 years of age. Sometimes there are no explanations. Other times it is because of certain chromosomal abnormalities, autoimmune disorders. So premature menopause is before 40 years. And when you have menopause between 40 and 45 years, it is early menopause. So basically, how do we manage menopause? Because the symptoms can impact on your health and overall well-being, you need to discuss it with your healthcare provider. Basically, it is important that you understand what is going on. The knowledge is most important, because if you understand what is going on, then you are better able to live with it. But if you do not understand, you panic and you think that there's something seriously wrong with you, when it is just a physiological process. And then after you've had knowledge, like what I'm doing for you now, you get a bit of counseling depending on the particular symptoms that you are suffering from. We are able to tell you some of the things that you can do to alleviate some of the symptoms that you are suffering. And if the symptoms are so bad that they disrupt your life, then it is time for your clinician to probably start thinking about treatment options. We have a variety of hormonal and non-hormonal interventions that can help you alleviate your perimenopausal symptoms. It is important to know that you can still get pregnant during your perimenopause period. So once you do not want to have children in your perimenopausal period, you should continue to use contraception until that time when you have attained menopause. That is 12 months without menstrual flow. Pregnancy after menopause is unlikely, highly unlikely, without fertility treatment. And some people can use donor eggs or previously frozen embryos from their own body. During menopause and after menopause, it is still possible to acquire STIs, sexually transmitted infections, including HIV, once you have unprotected sex, including oral, anal, and the usual vaginal sex. And this is because the thinning of your vaginal wall increases the chance of lesions and tears, and that increases your risk of HIV transmission through vaginal sex. So for the hormonal therapy, it is not recommended for women who still have their uterus, because when you take the hormonal therapy, it causes the lining of your womb to proliferate or grow, and that can increase your chance of getting endometrial CA. So hormonal therapy is used very cautiously in women who still have their uterus, but or who have other cancers like breast cancer. But if you do not have breast cancer, your uterus has been taken out, then hormonal therapy is an option that you can discuss with your gynecologist. But commonly we use non-hormonal therapies. Mainly there are changes to your diet and your lifestyle. You have to avoid triggers to your hot flashes. You need to know what the triggers are. It is different for everybody, and once you identify what your triggers are, you need to avoid them. You can keep your bedroom cool at night if you can avoid it. Have an AC in your bedroom. Wear layers of clothing so that if you start feeling hot, you can take some of the layers off. If you smoke, quitting smoking normally helps with the hot flashes. Exercising and losing weight is a good way to manage your perimenopausal symptoms. And sometimes joining support groups help. You guys exchange information, people tell what they are experiencing, and you realize that you are not alone. What you are experiencing, other people are experiencing too. Some people will be able to tell you their coping mechanism, and you can also try to see if it will help. When it comes to diet, if you take a lot of caffeine and spicy food, it will be advisable to cut down on these elements. Also, you should add fruits that contain plant estrogen into your diet. Soya bean, chickpeas, lentil, flaxseed, grains, beans. Those of you who like gobe like me, it helps a lot. And then of course, you can never go wrong with fruits and vegetables. I cannot end this discussion without a brief note on andropause. So a lot of people think that andropause is akin to menopause in women. And there really is a thing called andropause, or male menopause, as some people would call it. It normally describes decreasing testosterone levels in men. It is unlike menopause, because menopause is quite a bit sudden, takes a few years, but in andropause, for every man from the age of 20, there is a slow steady decline in the testosterone level in your blood, averagely 1% a year. So this is a very gradual process, and for a lot of men, the symptoms of andropause are very akin or similar to the symptoms of aging and the chronic conditions that come with aging. So until you have excluded other chronic conditions or complications of chronic conditions that the man may have, you cannot jump to saying that the person is suffering from andropause. A few symptoms of andropause include low sex drive, difficulty getting erections or erections that are not strong or usual enough for you to have adequate sex, lack of energy. Generally your energy levels are low. The things that you could do before in terms of physical strength, you are not able to do them. You may feel depressed or have irritability and mood swings, just like the women would have. There is height loss in some men. Some men will tend to have breast discomfort or swelling, and then they generally have increased body fat. They start to put on weight. And then in a few men, they may also experience hot flashes or sweating. So that's just a little bit on andropause to whet your appetite. You can share it with a man in your life if you are a woman listening. And if you are a man listening, please share these nuggets on menopause with the women in your life. Thank you very much for listening. My name is Dr. Rosemond Abuaji. You can follow me on all my social media handles. You can send in your questions, recommendations, if you need clarifications. And if you have suggestions and constructive criticisms, they are very much welcome. God bless you all.